planning your year's study, you must remember that the subjects you choose should be those which will be useful to you in whatever career it is that you will be doing. And it's most important that you should have the most up-to-date information about that career. If you want any further information, you can always go to your careers advisor. She has everything that you would need.
Would you like to use this one? It's always happening to me, too.
Are there lots of rules and regulations I shall have to learn?
Oh, there are not the rigid rules there used to be. Nursing's changed quite a lot in the last few years. Perhaps I'd better explain about that. A nurse's job is responding to people, not rule books. You learn to take increasing responsibility by using your own initiative, based, of course, on knowledge and sound reasoning. Look, perhaps I'd better show you what I mean. We'll start with the children's ward. I think it'll help.
Mrs. Mills, you can come in and see Seamus any time you like. Meal times.
Do I have to eat right?
No, dear. We give you exactly the same things to eat in hospital that Mummy does at home. Did you forget to bring anything, dear?
The doctor's stamps.
Well, Mum will be coming back again this afternoon. Perhaps she can bring it for you then.
First of all, I'd like you to see a room without beds. It's the schoolroom. They come in here as soon as possible, even if it does tire them. It's the atmosphere that's good, healthy and bright. You're not just nursing their physical ailments, but the whole person, mothering them, in fact, makes a big difference. Every case has its own problems. Tim and Bernard have been in bed here for ages with bone trouble, but there's plenty of life in them because we've made it up to them in other ways. That's Stephen over there. He's very good at modelling. He's responding very well to treatment now. We try to treat all patients as individuals, no matter what age they are.
Hello, Angela. Come to take your temperature, dear. What are you drawing?
Sister.
Sister? Doesn't look like sister yet. You better put some hair on it. Pop this under your tongue, dear. That's right, don't bite it.
Temperature all right this morning?
Yes, it's fine, Mrs. Sugar. And how's your embroidery coming on this morning?
Oh, well, I think I'm getting on very nicely. We've got the flowers all to do, in different colours.
And I suppose the
And
back of it's as neat as the front, of course.
I try to keep it so because that's what you should do, but in some cases you can't. You have to have the knots.
Well, we're doing out very well.
Yes, it's doing very nicely indeed.
It's been a long
it's right now for me to go home.
A long time, really, hasn't
Yes.
it?
Yes. Oh,
The nurse's job's to restore her patient's feeling of well-being, whatever way she can. You must understand them and their illness, the changes due to their illness, and how to make up for it until they're well. In other words, you're their guardian.
Just say to me, what kind of a night did you have, Mrs. Howes? And I say I had a lovely one last night.
It's a very satisfying job. Doing the right thing when your every action might have a big effect on your patient, mentally and even spiritually, is a big responsibility. When patients are afraid and anxious, good nursing can have a profound effect on their future health and the health of others. So a nurse's training is taken very seriously to develop understanding and initiative.
He's lovely.
You start with fundamentals.
We are going to talk this morning on meal service to the patients. This is a very important aspect of your nursing training. Your patient is an individual, and keep this in mind when planning his nutrition. Illness affects his appetite, so he must be treated accordingly. How do you tempt a patient's appetite? Yes, nurse.
The tray should be neat and clean with a colourful cloth.
Yes.
By serving the meal attractively and in small quantities.
Very good, nurse.
Making sure the patient is comfortable and prepared for the meal.
That's correct. Yes, nurse. Have you any suggestions to make?
By telling them it's nice and it's not very nice at all.
That's not as silly as it sounds. Giving patients a positive attitude towards their food is important, and suggestions do help. You see this every day in the wards.
The ward sister delegates duties according to your progress.
Mr. Bertram, you want a soup?
No, I don't want that, thanks.
The doctor wants you to eat as much as possible. He wants you strong for your operation.
That's all I've been doing since I've been in here, is eat, eat, eat all the time.
Well, I think it looks rather nice. I wouldn't mind having it.
No, I couldn't go.
Oh, come on.
Oh, well.
God.
Sister, you've given me apple pie here. Mr. Bertram over there has got rice pudding.
Oh, well, you see, apple pie is the main pudding for the ward today, and rice is for the special diets. But if there's any left over when we're finished, I'll bring some up for you.
That's very good of you, sister.
Righto.
Thank you very much.
No two people are the same. In learning to deal with them, you appreciate changes in their condition, when they can be allowed up, if they need special care. Always you are the trained observer, studying people's reactions for their significance. The front-line medical worker. Domestic duties are left to others.
Sit down, Liz. Now, we're discussing Mr. Bertram's condition and the problem of his diet. You were with him at lunchtime. Could you tell us what happened?
Well, sister, he had his first course all right, but he just didn't want his dessert. He said he'd had a lot to eat this morning and just wasn't interested in it. Perhaps you could have the egg flip at a different time.
No, we certainly couldn't do that. Nurse Scott, you could tell us why. You've just been learning about the subject, and while you're telling us, you could take some notes.
Well, yes, he must have small, regular meals because they're more easily digestible for him. His doctor's most emphatic that he have these meals regularly, and he can really have whatever he likes provided it's got the right food value. Take, for instance, Mr. Jones.
How much actual study is there?
Well, it's a full 3-year course with theory and practice going hand in hand during that time, unless you want to take the community nurse program.
What's the difference?
Community nursing's a shorter 1-year period where people are trained to give basic nursing care. It's most important. But for more responsible care, we need the registered general nurse with the higher standard of education.
That's why I need school certificate to begin as a general nurse.
That's right, yes, because you know how to study. And you've proved yourself diligent, and you've got a general basic education. Don't worry, you'll find it most exciting. Oh, and remember, there are lots of you in this together.
Hey, Sue, we've got an exam tomorrow. Try and run some of those questions. Drugs? Yeah, that'll do. Yeah.
All right. What's an analgesic?
A pain relief.
Yes. What drugs are used as analgesics?
Morphine, yes. Pethidine, yes. Sodium Gardinal, yes. Omnipod,
yes.
Phyceptone,
yes.
How's that?
What's the dosage of pethidine?
1,500 milligrams.
That's right. What about morphine?
10-15 milligrams.
Mm-hmm. Keep your fingers away. You're pulling your hair down. Now pin up the back.
How's that?
Hi, Heather. Got the clubs? Oh, good. Bye. See you tonight.
Bye.
Naturally, a nurse's own needs concern the hospital, since she's the centre round which other services revolve. A healthy life is what she needs. Comfort, excitement, all the things she's expected to understand in her patients. Free time depends which ward and duty you're working at the time, but pay rates are such that you can have quite expensive holidays. Senior students are encouraged to take the responsibility of living out, setting up a home of their own.
Coffee up.
Whoops. Sorry, I'm sorry.
Where am I going to put this? You haven't left me much room.
Oh, I'm sorry, dear. We make such a mess around here. Are you off now?
Well, I'm on duty in half an hour.
Oh, it's that late. I'll put my shoes on and drive you down.
Well, make sure you're back in time to finish the ceiling, could you, John?
It's all right. Mary's coming to collect me, so you needn't worry.
You sure?
Yes.
Well, I'll look after these two then.
Will you, dear? Thanks very much. I'll see you tomorrow afternoon and bye.
Right. You won't be long here anyway, dear.
Bye-bye.
Bye-bye.
I'll get it.
Hello, Mr. Wright. Is something bothering you?
Yes, could you do something about that snoring over there?
Well, as you know, Mr. Bertram's got his operation tomorrow. Do you think you could sleep if I gave you a nice warm drink of milk? That's what we'll do.
We'll try
That
that.
helps sleeping, doesn't it?
All right,
And you're quite comfortable?
Yes, thank you.
I'll go and get you a drink.
I think he's more worried about Mr. Bertram's operation, don't you?
Yes, I think that's all it is. We know, Marty.
Here's the chronic ulcer, nurse, for which we're doing the operation. You can lean over and we'll go through the motions. Down here is the vagus nerve, the anterior vagus, which can easily be felt by running a finger over the surface. You get the impression of something around there. So fingers jumping over. That's it.
Towards the end of your training, you'll put this knowledge into emergency use. Accuracy is vital. Your hands may well hold a patient's life. Through practice and knowledge, you'll understand what's involved. And because you're used to increasing responsibility, you make decisions affecting the health of even the most seriously ill person. This is an intensive care ward. Critically ill patients have kept together for maximum attention, fastest possible care. Here, nursing is the greatest factor in the patient's very survival. It isn't one ailment you're treating, but the patient's entire grip on life, the whole person. Nursing is an art.
Terminals adjusted to maintain satisfactory contact. Reading unchanged at normal conduction and rhythm.
Patient progressing satisfactorily. Pulse and blood pressure charts discontinued.
Saline running well. House surgeon to see
House surgeon notified and patient returned to theatre. Less morose and taking part in group activity. More willing. Perhaps it's seeing the children yesterday.
As medical science advances, nurses will be called upon to maintain even more strongly the link between their patients and normal, healthy life. The lady with the lamp, the Florence Nightingale of the future, will be a highly trained professional whose work begins with the human touch and progresses to an understanding that few others ever know.
Hello, sister. I'm ready to go now.
Oh, good day then. Everything's organised. The taxi's ordered and your wife's waiting for you at home. There's just your diet to remember. Don't let her coax you off it to celebrate.
I won't make that mistake again.
I've asked Miss Scott to see you from the ward. Here she is now. So is your guest.
Sure.
You're ready to go, Mr. Bertram?
Yes, thanks.
Good. You can manage your suitcase?
Yes, I've left most of the books in the ward.
Yes, and you've got your appointment to come back to our place?
Yes, I've got that. I'll pop up and say hello, and I want to see the old chap in the corner when I come out.
Oh, please do. He'd love that.
Hello there. What's this? More rice pudding?
But it doesn't seem to have done you any harm.
No. Well, thanks very much anyhow for what you've done for me.
It's all right. It's been a pleasure.
I'll wait to see you again when I come to the outpatients anyhow.
Okay.
Sure.
Bye-bye.
You'll find it a most rewarding life, Susan, right from the beginning. And after you graduate, well, you can specialise in midwifery, psychiatric, theatre nursing, and, well, after a year as a staff nurse, perhaps you'll want to study overseas.
I had thought of that.
Oh, good. The new salary rates help, and there are scholarships available, too, if you do well. So you see, it's almost like a new profession now.
Yes, I think I have seen what you mean. Thank you very much for showing me around.
I'm sure you'll do very well, Susan. Who knows, you might be on the side of the desk one day.